Primo wedges and turn sheets are used to offload pressure areas, turn, and boost a patient while in bed. Ideally, you will use 2 staff members to place wedges or use the turn sheet. Obtain the wedges and turn sheet, then wash your hands and don gloves prior to approaching the patient. Inform the patient of what you plan to assist them with. Be sure to lock the bed, lower the head of the bed, and raise the height of the bed to accommodate the height of the shorter staff member. Then lower the bed rails. One staff member will roll a chuck pad, if needed, into the turn sheet in preparation for placing it beneath the patient. To place the turn sheet, gently assist the patient to log roll away from the staff member who rolled the sheet. A staff member will remain on each side of the patient during this process. While the patient is in the side lying position, the staff member with the rolled turn sheet will then gently press and tuck the sheet beneath the patient from the posterior side. Once the sheet is tucked beneath the patient, assist them to log roll back into the supine position. Then have the patient log roll to the opposite side. The other staff member will then unroll the turn sheet and chuck pad to extend across the bed. Assist the patient to log roll back to supine, then be sure to straighten out any wrinkles in the layers beneath the patient. In order to place the wedges, assist the patient to log roll toward one side. The staff member who is positioned posterior to the patient will then place the wedge above the patient's sacrum at the torso and one below the sacrum. Place the non-slip side of the wedge onto the surface of the bed with the handle facing away from the patient. You can slightly angle the bottom wedge inwards to prevent patient migration. Once the wedges are placed, check to be sure there's adequate space between each wedge. You can do a fist check by placing to see if at least the width of your fist fits between the wedges. This ensures the sacrum is properly offloaded. To boost a patient using a turn sheet, be sure the sheet is properly placed beneath the patient. Ensure a staff member is on either side of the patient, positioned approximately at the patient's waist level. You can use the handles on the turn sheet, but you may need to roll the ends of the sheet if it is too wide. Each staff member should place one hand grasping the sheet just distal to the patient's hips and one hand approximately at the level of the patient's shoulder blade. Be sure to use an underhand grip on the sheet and squat with a flat back to use your strongest muscles and prevent an injury or straining. Determine which staff member will count to 3. Then instruct the patient to cross their arms and lift their head. On the count of 3, both staff members in a squatted position will simultaneously step and weight shift toward the head of the bed. This ensures that you are using your entire body to boost the patient toward the head of the bed rather than using your back or arms. Be sure the patient is positioned properly. Once this is achieved, raise the bed rails and lower the height of the bed for the patient's safety. Then raise the head of the bed as appropriate or to achieve patient's comfort. Be sure the patient has all needs, including personal items and a call bell, and set the bed alarm if appropriate prior to exiting the room. Be sure to complete hand hygiene before or after exiting the room.